Hello, thanks for joining me at the PBM and Tinnitus Lab channel. I am Dr. Katoyun Montazeri. As I told you, I'm making a series of videos about the triggers and improvers of tinnitus. In this video, I will talk about the effects of medications. And this is the fourth videos of this series. A lot of people may be surprised by this, but tinnitus flare-ups are annoyingly common with certain medications. In fact, many medications can trigger or worsen tinnitus temporarily or persistently, and these medications called ototoxic or air toxic. But you should note that the risk varies a lot by the dose of medication and the duration of using, and also from a person to person. And not everyone reacts the same way. But let's have a look at the medications that can trigger tinnitus. These are the drug groups that can trigger tinnitus. At first, pain relievers, which are very common, and they can trigger tinnitus. For example, aspirin with high doses, and ibuprofen or Advil, and naproxen or Aleve, and diclofenac. All of them can trigger tinnitus. So the next time that you wanted to use a painkiller for a small pain without exploring the origin of pain, please remember that it can trigger your tinnitus. The next group are antibiotics, especially the aminoglycosides, including gentamicin, neomycin, and topramycin. These are well-known ototoxic drugs. So you should note that they can damage your hearing system. And also erythromycin, azithromycin, and clarithromycin, and ciprofloxacin and levofloxacin, all of them can trigger tinnitus. The heart and blood pressure drugs, including furosemide or Lasix or bumetanide, which are diuretics, and as I told you, they can increase the urination. And the beta blockers like propranolol and metoprolol and lisinopril and enalapril, all of these drugs can flare tinnitus. On Reddit and Facebook tinnitus groups, I saw many questions about psychiatric and antidepressant drugs and if they can trigger tinnitus or not. Yes, these drugs can trigger your tinnitus. For example, sertraline, fluoxetine, vanilla Vaccine and duloxetine, alprazolam, lorazepam, which are from the benzo groups, and bupropion or valbartin, all of them can cause tinnitus flare-up. And the chemo drug or chemotherapy drugs, including cisplatin and carboplatin, can trigger tinnitus, and other meds, including isotretinoin, or Accutane, which is used for treatment of acne, and also quinine and chloroquine, which are anti-malaria drugs and used for other issues as well, and theophylline, which is used for respiratory infections, respiratory issues. For example, it is a bronchodilator, and sildenafil or Viagra, all of them are in the group of medications that can flare up your tinnitus. There are some important tips. At first, a dose is very important. higher doses equal higher risk of flare. And uh, in most of the cases, the flare-up is reversible. It's a very good news, but not in all of them. And in some cases, the flare can be permanent. And you should note that there are some withdrawal effects, especially for benzodiazepines and antidepressants. And withdrawal of these drugs um, can flare the tinnitus, even if they were useful before. But the tinnitus triggering meds hit different parts of the ear or brain. But if we want, we can categorize the mechanisms, and the mechanisms usually fall into certain buckets. So let's have a look at the mechanisms of damage. Many of the medications can damage the hair cells. You know that the hair cells in the cochlea normally convert a sound vibration into a nerve signal, and the damage to these hair cells can cause hearing loss, and a loss of input causes tinnitus, may cause tinnitus. One of the, as I told you, aminoglycoside antibiotics are very important ototoxic drugs, and they can damage the hair cells. And also from the chemo drugs, cisplatin, and from many of the diuretics at high doses can damage your hair cells. And some of the drugs can cause brain signal imbalance. They may increase the neural excitability and reduce inhibitory calming signals. Some of the antidepressants, especially during dose changes, can cause this, and also the benzodiazepine withdrawal can cause the imbalance of brain signals. And some drugs can alter blood pressure and viscosity, and also they can change microcirculation. And these drugs are from the diuretics group and beta blockers, and they can cause pulse-style tinnitus and sudden flare-ups of tinnitus. As I told you, the inner ear has a delicate blood supply, and even small changes can irritate it. So the drugs that can cause electrolyte and fluid shift may irritate the cochlea and disturb the precise balance of electrolytes, including sodium and potassium. And these ions are very important in neural signals, and their disruption leads to a distortion in nerve firing. These drugs are from the diuretics groups and chemo drugs that can cause an electrolyte and fluid shift and trigger tinnitus. And this is a general mechanism that can happen in many drugs. You know, a brain learns the tinnitus sound, and a drug can destabilize the system and reactivate that learned noise. So can trigger tinnitus. And this fact explains that why a drug causes tinnitus only in some people and not in all of the people, or a drug can trigger tinnitus in just some of the patients and not all of them. And Another issue is about stress and anxiety. Some medications which are used for ADHD or attention deficit hyperactivity disorder, and also for narcolepsy, which is a condition that in which the patient very feels very sleepy throughout throughout much of the day. And also the drugs which are used, some of the drugs which are used for weight loss, these drugs are stimulants, and it can stimulate the patient, and they doesn't cause tinnitus, but they make the brain focus on tinnitus. So these are the mechanisms of triggering tinnitus. But why the flare-ups are often temporary? Because of the natural body power, because the hair cells can recover, the neurotransmitter can rebalance, and the brain gain or brain sensitivity can settle back down. So most of the flare-ups are temporary, but some of them are permanent, unfortunately. But when the flare-up is related to using a drug or withdrawal of a drug, if the flare-up is started within hours to 2 weeks of starting a new med, increasing the dose and switching brands, and if the flare improves when the dose is reduced and the drug is stopped, you can suspect to the medication flare-up. But when we suspect that the flare is related to a withdrawal, if the flare began 1 to 10 days after change of a drug medication, and when doses were missed, tapered, or med was stopped, and after that the flare is begin, and when the flare comes with anxiety, insomnia, internal vibration, sound sensitivity, and brain fog, means cognitive impairment, you can suspect to a withdrawal flare-up. But there are noise-related flares, and how we can distinguish that this flare-up is related to a medication or to noise. Noise-related flares happen immediately or within 24 hours of loud music, concerts, power tools, and using headphones and earbuds, and they often come with earfulness, temporary hearing dullness, and hyperacusis, means hypersensitivity to sound. And the noise flares usually peak gradually and improve over days to weeks. These are the characteristics of noise-induced flares. But some flares are related to stress, and how we can distinguish them from the medication flares. In stress-related flare, the flare builds during emotional stress, poor sleep, and illness, and the loudness of tinnitus fluctuates hour to hour, and it gets worse when you focus on it, improves during calm or distraction. And you should note that stress flares are very real, but they don't damage the ears. But to my knowledge, it's very difficult to distinguish medication flares from stress-related flares, because when the patient suffer from has an emotional stress, they usually use different medications, and so it's a little bit difficult to distinguish that the flare is related to stress or is related to a new medication, you know. Thanks for your attention. If the video was useful for you, please subscribe the channel and suggest the channel to the tinnitus sufferers. For the next video, I will talk about the physical and postural triggers of tinnitus, which are very important and very common and often overlooked. I pay tribute to my compatriots who were killed in the last few weeks, and I hope peace and safety for the people of the world. Thanks for your attention.